Governor Glenn Youngkin is addressing health disparities in his new COVID-19 action plan. It discusses research partnerships with the Virginia Department of Health put in place since the governor took office.
But some health equity advocates say there are better ways to help underserved communities. Here's Ann Sparacco.
Health disparities among COVID-19 cases are still prominent at this point in the pandemic. The Virginia Department of Health's Equity Dashboard says in the past month, the Black community is almost twice as likely to be hospitalized in the state. It's a problem Governor Glenn Youngkin is trying to address in his new COVID-19 action plan, starting with an initiative called the Vaccine Communications on Hesitancy Education Work Group. The goal is to study barriers in places with low vaccination rates. Gayleen Kanoitan with Celebrate Healthcare says she applauds the governor for addressing the problem, but says more needs to be done.
COVID by no means is partisan, it's bipartisan. And so because it affects everyone. Many of the resources that he's providing has already been created.
Kanoitan says in addition to promoting mobile vaccine clinics in underserved communities, she wants to see more opportunities for people to access the vaccine and testing independently.
Make sure that if we have at-home tests, it's available, readily available at no charge. If you want to make an endemic, at the end of this pandemic, call it an endemic, let's put more resources in preventative care.
Youngkin wrote in his report about 1.6 million Virginians are still not fully vaccinated, but he hopes his initiatives will make a difference. In Norfolk, Ann Sparacco reporting for 13 News Now.
Governor Youngkin says his team and VDH scheduled about 200 mobile vaccination units across the state to reach underserved areas through the end of March. He says hundreds of additional vaccine clinics are scheduled through the end of April.